Okay, thank you. Um, so I'm gonna say welcome again. Apologies. I am Dominique Morgan, as I mentioned before, the Chief Operating Officer here at Health Leads. In a bit, I will be introducing Desiree Collins Bradley and Kathy Salazar, who are part of the Caregiver Design team. Welcome, and we are really excited to kick off today's summit that is designed for and by caregivers. And so looking forward to some great discussion, some great conversation, and also the culmination of what has been probably 2 years of work with various caregivers who will be involved in the process today. So excited for all of that. Before we get into kind of the meat of today, would love to walk through a couple of housekeeping items. So first and foremost, if you are interested in translation, please click the global interpretation icon to select your language. If you need closed captioning, you can click the live transcript button to enable closed captioning. And then to use other Zoom chat features, you'll see the bubbles on the side, and then you'll also see that you can ask questions and interact with the folks who are kind of behind the scenes, and there's a whole team behind the scenes where you can ask questions and also interact with folks. So appreciate you all using those functions. And if you have any questions or have any technical issues, that's also a great place to go into the Q&A to try to get assistance. All right, if we could go to the next. So Health Leads, who are we? We are a national nonprofit who work locally and nationally to remove deep-seated, deep-rooted systemic barriers to health. We believe that everyone deserves health and well-being and dignity for every person in every community. And what that means is we will work in spaces that are as close to the ground as actual kind of food helping with food disparities and that kind of thing. And we'll work all the way sort of all up the spectrum and working in policy initiatives, et cetera, all with the idea that we recognize that racism and health are closely tied together, and that as we work through breaking through racial health inequities, that we'll improve health for all. So, and our mission in doing that is to really elevate and amplify community voice, and this is why summits such as this one are so important to our mission and our vision and the work that we do. So we thank you for joining us today. And if you're more interested in learning more about Health Leads as an organization, please feel free to jump to our website. And I'm sure that information will be put into the chat and other materials later on. But we'll welcome you to participate. We welcome you participating in this, and then also would love to engage with you on some of the other efforts and initiatives that we're doing across the country. Can we go to the next slide? So one other thing that is really indicative to the work that we do in Health Leads is that we always operate we start our engagements, our meetings, et cetera, with practice agreements. And this is just a good way to create the platform, the table that we're all going to come to and kind of eat from, so to speak, to use a metaphor. And so these practice agreements are core to who we are as an organization. It helps us as we interact with folks both within our teams and also external partners. And so we wanted to make sure that we kicked off today with a common understanding of how we're going to show up in the space today. And so those agreements are, and be present and accountable, feel no pressure to speak, feel no pressure to speak, but also resist the temptation to stay silent. And so certainly please use those chat functions as also when in some of the breakout sessions, I think there'll be dialogue as well. And so feel free to engage there. Be brave and be inclusive. Our values and our cultural identities and personal experiences matter. Recognize that conflict is always possible and conflict is okay. Take space and make space. Call attention to people's unheard voices, ensuring that all individuals have space to fully participate. And then address racially biased systems and norms. Call out power dynamics, recognize personal biases, and consider how they may impact actions. avoid becoming defensive when Black, Brown, or Indigenous folks speak from lived experience with racism. So we'd like to ask everyone to adhere to our practice agreements, and also adopt them as your own. Please take them and use them in other spaces if you feel that they're applicable. This particular organization or this particular group, i.e. the caregiver design team and coalition members, also have some additional practice agreements that we'd like to share with you. And so the added community agreement here is that don't bring more than we can carry. Recognize that the work that we do or the work that we're talking through in this caregiver summit may bring up emotions and trauma. Stay aware of your own needs. Take measures to care for ourselves and measures to care for yourself. Ask for help when need arises, and stay sensitive to the needs of others when possible and appropriate. So those are some of our practice agreements in this specific community agreement, which I absolutely love that, especially the stay aware of your own needs and be okay with the fact that there may be moments throughout the day that you feel overwhelmed or just need a break or need a pause, and please feel free to do so. Alrighty. So this slide is one that Taiji, who I'm going to put on my Taiji hat right now, wanted to share with the group as a way to welcome folks into this discussion around what does it really mean and what are some of the things that are really important and critical in the caregiving space. And I actually love these type of slides and this type of activity where it's not prose, but really just sort of one word and what like a compilation of words and what do those words invoke. And so what you'll see here is some of the work that the team has done in getting to this point is creating this kind of word spectrum around what it means to be a caregiver, what's important to caregiving. And you'll see really, really amazing words like patience and compassion and love and empathy. And you'll see some other words that are real, exhausting, stressful, financially distressing, having to be resilient, altruism, and other things. And so it's unenlightened. I actually love that. And so think this is just a way to sort of kind of set the stage for a lot of the concepts and the discussion points that will be talked about throughout the day. And we invite everyone who's participating in the space to really bring themselves, and to think about what are some of the things that you relate to when you think about your caregiving experience. And I personally am a caregiver as both a mother, but as someone who has older parents, and also has had a parent who has unfortunately passed on when I was younger with a critical illness and had to be put in the caregiver space. And I think all of us can think about times where we've been in that space, even when we're not necessarily a paid caregiver, but really taking care of friends or family or community. And what I think is really amazing about the work that the Caregiver Coalition and the design team has done and will showcase today is really the breadth of experience that will come in terms of what caregiving really looks like, but also the value that caregiving has to our everyday, day in, day out, even if you're not in a primary caregiving role, recognizing that someone in your ecosphere maybe, and that actually is how, like, what makes the world get better, right? I think about my neighbor who's an elderly gentleman and the fact that his nephew comes and cuts his grass every week because he can't do it anymore because he's physically not able. And that improves his uncle for sure, but as his neighbor and as someone who shares a lawn with him, I appreciate that there's someone in my community that is stepping into the role as a family caregiver. So with that being said, I think the next thing that I'm moving into is some introductions. Oh, but first I actually want to do some acknowledgments. We wouldn't be here as I mentioned before. Health Leads is a national nonprofit, and so the majority of the work that we do is because we have fantastic foundations and other entities and private individuals who feel passionate about both the work that we do and also trust us to create opportunities for community to come together. And so with that in mind, I'd like to acknowledge some of our sponsors. First, I'd like to acknowledge the Lucille Packard Foundation for Children's Health. They've been an amazing partner in this work from the beginning and a fierce supporter of caregivers of children and youth with special healthcare needs who see the value in working with caregiver ecosystem to achieve our shared goals. In many ways, they represent what we love to see in philanthropic partnerships. They're not just someone who writes a check, they actually roll up their sleeves and really get involved in the work as a thought partner. So we at Healthies deeply appreciate them being a part of this journey. We'd also like to acknowledge that May, and we're in May 2nd. Can you all believe it? It's already May 2nd. That we'd like to acknowledge that it's Military Caregiver Month. And we want to give a huge shout out and appreciation for the caregivers who are current military and potentially former military caregivers and military veterans. There's so much that we often take for granted when we're outside of that military ecosphere, so to speak, around like how much caregivers play a role in military, our veterans and those people who are in active duty, their ability to actually show up in the spaces and be able to serve their country and to serve kind of community while also making sure that house and home is taken care of. So we really want to highlight that. I think it's awesome that we were able to have this summit at a time where important part of our community on a large base as Americans is being acknowledged for the caregivers in that space in the military are being acknowledged at the same time that we're also hosting this National Caregiver event. So with that, you will also soon the team is actually we want to know who's in the room. And I see that there are folks in the chat as they're entering the room to say, hey, I'm so and such, and I'm from this place. But I think we're actually going to have a formal poll, and we're going to ask some people and it's in English and in Spanish. We're going to ask people to fill out that poll that we'll reflect on in a bit to tell us who you are so that we get a sense of who's in the room and who's really interested in the topics that we'll be talking about today. Now, with that, I'd like to pause and say that and move to the design team. So as much as Health Leads is actively engaged in the caregiver work, as we mentioned before, that this summit is both designed to and for and by caregivers. And so we want to shout out and we want to give a moment to introduce the folks who are part of the design team. And so I'm going to turn it over to Kathy and Desiree. And I do want to also acknowledge that this is our second summit, and Kathy, who is about to speak, has been part of both the original summit and this one. And so we want to thank you both for your time and your talent and your dedication to this work. And I'm going to stop talking and I'm going to let you all introduce yourselves. Thank you.
Thank you, and good morning, everybody. I am Kathy Salazar. First and foremost, I'm the mom of 9 children, 3 birth children and 6 adopted. My youngest 3 daughters all have complex medical needs, and just really trying to navigate this world. I've had them, and they've been my daughters since they were all anywhere from 2 weeks old to 5 months old. So they've been with me their whole lives, and getting into the caregiver role came with when they joined our family as my children. I'm also a family advisor for our Title V Children and Youth with Special Healthcare Needs family advisor. So I continue to work in this area and help families, social workers, and nurses kind of access resources for our families of children with medical complexity in New Mexico from a parent perspective, which can be sometimes really different than a perspective coming from a professional or someone who it may be siloed into their own area of expertise. And so I kind of look at it just because I look at it from a parent perspective because I've had to access all of these services over the years. And so very happy to be here the second time and being part of the design team, and really appreciate Health Leads and all they do to really support caregivers throughout the country. Desiree?
Thank you, Kathy, and thank you for paving the way for new people like myself. So I am Desiree Bradley. I live in the Houston metropolitan area. I am a mom of three, married for 25 years, and I entered the world. And as I was preparing for this session, I had a memory that came across. I was on a plane, and my world of caregiving actually started when I was just about maybe 2.5 years old, as my mother was battling an illness. And I had my little baby brother, and I remember having to step in and be his caregiver because we had no one else there. Father was working and no family. And I remember putting the pot on the stove and waiting for the bubbles to bubble so that I could put that old glass bottle in that pot to get warm. And I think about that and I said, I've been preparing for this life of caregiving for quite some time. But so I have a 25-year-old who is well. I have a 12-year-old that is well, although I'm almost 5'11", he's well taller than me. He's a big boy. But my daughter, who is 16, Deance, little Miss Sassy Deance, is, and you'll see her in the middle, was born with a very medically complex genetic disorder called JARC11. And I didn't find out till I was well deep into my pregnancy. But as we entered the NICU and was there for almost a year, I learned that I was a caregiver, thrown into this caregiving world head first. I would say head, feet, arms, legs first. And she'll always need a lot of care. So I know that my world of caregiving will go on well into my elder age. But I want to say, all of us here come from many different walks of life, whether we are caring for a child with a complex medical condition, aging parents, our neighbors, communities. If you really think about it, all of us are really caregivers in some way. So just really excited to be here and happy to be a part of this design team. And we all kind of really, I think this is our passion, serving others. So yeah, and I can go right into the theme if that's okay. I know there's a slide for that.
Hey, Desiree, do you mind if we step back for 1 second? I want to talk about my role as a caregiver, just because I have a very interesting slide that
Yeah.
it's not
we go on the fly. This is good. Go back to go forward.
Yep, thank you very much. So my slide is my daughter Sydney. It's her handprint, and it is in the theater space at her high school. She was in theater from the time she was in 9th grade all the way through 12th grade, and when she graduated, and this is the year she graduated. This was after she directed her first play, which was at the end of her senior year. And this palm print reminds me that no matter how medically complex our children may be, or the adults that we care for, they are always entitled to dignity of respect and dignity of risk. And if I had been, and I was at times very scared as a mother, just reminding myself that she had the right to experience life. And in doing this and kind of letting go a little bit, because she's very medically complex with very, very rare syndromes, but she's also her capacity to understand the world and be part of it is just normal, just like anybody else's. And so having to let her go to high school with a running IV line in her chest, and her choosing to be part of student government, be in drama, be in plays, go out of town for student government activities, It was a reminder that she is entitled to dignity of risk, just like the rest of us are. And when she graduated from high school, she graduated with many cords. She was student body secretary. She was president of the drama club, and she did all kinds of other things, had many friends, and ended up having a boyfriend who she still has 2 years later. And so just a reminder that our children are the adults we care for are just entitled to this dignity of risk. And it's a good thing for us to remember, because sometimes we just want to wrap them in cotton and make sure nothing else can happen. So that was the other reason, for me being here outside of what I do professionally, is just being her mom and my other two daughters' moms. So that's it for me, Desiree. Thank you so much for letting me go back.
Yeah, no, and I love that you said wrapping them in cotton. As you know, sometimes we have to let our baby birds fly, as I've learned raising a teenager in the high school system with medical complexities. It's been an interesting whirlwind, but I wouldn't change it for the world. So I think we can go into the next slide. So the design team, I'm really proud of our design team, and we really put a lot of thought into coming up with the theme for this conference. So you'll hear for the summit. So you'll hear all the sessions that you attend and participate in will fall under these buckets. So we came up with CARE, so that's CARE, connect, advocate, rejuvenate, and educate. So you'll hear these themes throughout the summit. And so I'm going to kick it back to Kathy to kind of go through the C and the A, and then I'll come back and take the R and the E. Kathy, I'll pass it to you again.
Thank you, Desiree. So the C and the A for this summit are about connecting and advocating. For me, they're about compassion and acceptance. The compassion that I have for my children, the compassion I have for the families that I work with to help guide them through resources. And the A is really about acceptance. I think if we can't accept where we are, where our kids are, where our loved ones are in their journey, I think it makes it very hard to have a really good quality of life. So yes, officially connect and advocate. For me personally, it's about compassion and acceptance. Desiree?
Yes, so rejuvenate and educate. I'm going to say that again. Rejuvenate, rejuvenate, rejuvenate. Because we know as caregivers that it's not easy, right? We love our family members, we love our community, but it is heavy, heavy work. So we want to make sure that you guys know that you need time for self-care to rejuvenate and refill, so that, take care of you as well and give yourself some grace. And then educate. You think about all the things that you're going to learn here in the summit, things that you've learned as your journey goes, and spread that, because there's folk coming behind you that don't know what you know. And though, as you learn this education, share the education. I always say sharing is caring. So we hope that, the themes resonate with you and that you get some really good stuff out of this summit. And with that, I'm going to pass it back to Dominique, aka Taji.
Thank you for that. That is amazing. And thank you for walking through the theme for today. I love it. Care, right? It is the core to caregiving, but it is also core to being a caregiver. And so please really find where you can where you connect with any of those three words, those three acronyms that are tied to, or four acronyms that are tied to the word care. So we're really excited. So I'm gonna move us along a little bit. And I want to just say thank you to Desiree and Kathy for but again, time and talent, but just how you've contributed to the work, and to just what you've contributed to the day so far, right? You've certainly set the tone for what we're going to do today, and just really appreciate how much you've brought to the work. And Kathy, appreciate your long-standing role with the group as well. This is, you get to reflect on sort of a much longer path than some of us. So thank you so much for that. All right, now with that, what is the day going to look like? And again, I'm putting my Tai Chi hat on. And so just want to quickly go through the agenda for today. And so we've already actually had a rejuvenation exercise. So I'm so happy that Desiree, you focused on rejuvenation as such a critical part of being able to show up for others, is being able to show up for ourselves. And I know that's not always easy when you have um, people and things that are very immediate. And it's the thing that we often can put to the back burner. And so we have to just continue to try our best to find spaces to rejuvenate. And so we found 30 minutes this morning to be able to welcome people into a rejuvenation exercise. Right now, we're in the welcome and overview stage of our summit. And we will shortly, in about a minute, move into our keynote related to the Caregiver Coalition. And then we have some a session around advocacy and action, driving towards caregiver sustainability, and really excited for that. There'll be some breakouts around 2:45, and these are all Eastern time. So obviously, the time zone change, that the times will adjust accordingly. And the breakouts are tied to the four acronyms, the CAR acronyms. And so I'm not exactly sure logistically how you choose which one you're going to join, but I'm sure there'll be some information, and someone who is much more knowledgeable than me will be able to direct you accordingly. And then we're going to close between 3:50 and 4, related to our Caregiver Coalition. And actually, our CEO, Alex Quinn, is going to step in and do that closing for us. So we're looking forward to hearing from her. And then we'll end the day with a rejuvenation exercise, because it's so important to our ability to care for others is in fact carrying also the need for us to care for ourselves. So with that, I think my part might be done, and I have one other thing. So let's move to, I guess, the next slide, where I will introduce our Caregiver Coalition. And so I'm going to pass this on to Nanfi. And I'm not going to try to pronounce your last name because I don't want to mess it up. But appreciate you being in the room, and I'm going to pass it off. And thank you all for allowing me to show up a little less than prepared in this space. Oh, I also want to say who's in the room. You can see the poll is up. And so the majority of us are caregivers and caregiver advocates. And so, and a couple of care receivers. So we've got a nice little compilation of folks, and we know that there'll be people in and out throughout the course of the day. And so, just again, appreciate people being here, and hopefully everyone gets a little something to both rejuvenate and to help with how they show up in the caregiver world. All right, with that, I'm going to pass it along. Thank you.
Well, good afternoon, everyone, or good morning, wherever you are in the time zone. My name is Namphy Lubogo, and I'm a caregiver for my husband, Stephen, who is impacted with chronic medical needs, as well as a caregiver for my 24-year-old daughter, Stephanie, who has multiple special healthcare needs. And I'm wishing Taiji healing thoughts, and I hope you feel better, Taiji. On the screen today, you see some of our Caregiver Coalition members. This is just a few of us who are going to be speaking today, but we are a group of about 16. So shout out to those who are on the screen, and shout out to those that are watching. I've been involved in this work from the beginning as a member of the original design team with Kathy, Taiji, and others. And so it's really great to be here today to see everything come full circle. In 2021, we designed the first National Caregiver Summit, which brought together caregivers from all across the country with diverse caregiving experiences. And for us at that time, the experience was liberating because we fostered a true sense of community, and we provided a space where we all could learn from each other with people who really got it. At that time, one of the key priorities that was highlighted by both our design team and the members of the summit that we put together, the attendees all brought forth the key priority of caregiver financial sustainability, because we believe that it was crucial for us not to only maintain our community of caregivers, but we also wanted to make sure that we expanded it to other caregivers. And obviously we needed to bring in care receivers the people that we care for, and we needed to do that as well with organizational partners. So following the guidance and what we learned from that summit, Health Leads established us, the Caregiver Coalition. And it's a cohort that's primarily composed of caregivers, both family and formal, care receivers, and organizational partners. And some members of the original design team supported this initiative in various ways. Some of us provided feedback on the coalition's design. We applied to join the Caregiver Coalition, and we promoted the application process to others. So kind of very full circle for all of us. So over this past year, my fellow coalition members and I embarked on a significant journey to attain financial sustainability. So over the past year, my coalition members and I embarked on a significant journey to attain what we had been given to take charge of, which was to attain financial sustainability for our community. So composed of primarily caregivers, our leadership includes 2 co-leads, one of whom is a family caregiver, and the other one who serves both as a community health worker and a family caregiver. So really diverse. And we chose this structure deliberately because we wanted to ensure that the voices of the caregivers were at the forefront of all the efforts that we had. So as we began this journey, Health Leads guided us through several alignments and relationship building activities. First, we established community agreements. You heard some of that this morning. And we started every meeting intentionally with that. The other thing that we, and at every meeting, all those, the agreement was spelled out to us, which was really important because it helped to ground us for the work that we're going to be doing at each meeting. The other thing that I really loved is that we also started the meetings lightly with music, and true to really community, we all contributed to the music that we would hear every time. So it was really nice. We had it at the beginning, during our breakouts, during our breaks, and also at the end of the meeting. So really just setting that tone of community together. So we established the community agreements, like I said, and that really covered how we collaborated and supported each other in that space. We created a broad and inclusive definition of caregiver. And additionally, we aligned the root causes of caregiving inequities such as racism, sexism, ableism, and so much more. And then we participated in a series of foundational sessions, including a policy session that helped us to understand the barriers that were faced by different caregivers, such as family caregivers, community health workers, home health aides, and doulas. And we explored successful strategies for improving sustainability and innovative practices among different care groups. So it was really nice to hear, from all the different caregivers. And for the first, for us, for many of the people that were contributing on the Caregiver Coalition, this was the first time we were all in these spaces together. So that was a really great opportunity. So I'm going to hand it over to Melissa, my colleague Melissa, who's a fellow coalition member, and she will tell you guys more about our process.
Thank you so much, Nancy. It's a pleasure to be here today. Hello, everyone. My name is Melissa Como, and I am a proud military caregiver. I care for my husband, who is a combat wounded Marine, and I really appreciate the shout out to all military caregivers who are caring for our service members, their veterans as well. So as Nancy mentioned, one of the initial sessions we participated in was on innovation. Before diving deep into our project, we established a shared understanding of what innovation was. And we just absolutely love this quote. We were inspired by design justice. We see innovation as both imaginative and practical. It's about envisioning new possibilities and making them a reality. When we think of innovation, we often think about the latest iPhone or some other form of technology, but caregivers are innovating every single day. I'm now going to pass it to one of our fellow coalition members, Tim, to share about a time he was innovative in his life. Tim?
Hello, everyone, wherever you are listening from. It's a pleasure to be a part of this conversation. My name is Tim Neon-Singh. I'm with Michigan Health Endowment Fund, and it was an honor and it's a privilege to be a part of this work. And so kind of keeping in the theme of food, and as Dominic mentioned earlier, kind of kicking things off, part of the example of innovation, also I love cooking. I love being in the kitchen. But one of the when we're kind of talk about prototyping and innovation, we had in-depth discussion about this. And so I always kind of think about, my first time I was tasked to making a turkey for my whole entire family. There's about, 20 of us. And obviously, on Thanksgiving, making a turkey, it's a big deal. You're it essentially. And so, but I remember there's a few recipes I wanted to try out, and but obviously I didn't want to buy 4 or 5 different turkeys to play around with. So I used chickens. I got a whole chicken, about a couple of them, and I had different ingredients as I wanted to use. And so it was kind of prototyping, figuring out, well, how will this taste? How will this cook? Is the flavors going to be right? And just kind of figuring that out. But really, the point was to kind of preparing for sort of the bigger picture thing, like trying to kind of figuring out, is this sort of recipe or, I'm going to be doing, is that possible to kind of scale it up, and kind of figuring out, once I scale up, how is that going to look like? Once I sort of, obviously a turkey is a little bit thicker. And so, how much more water am I going to use? How much more seasoning am I use? But the goal is, is getting the flavor profile just right. And but anyway, so as there was a lot of sort of like these examples that popped out in our conversation, just sort of really thinking outside the box, because as Melissa said, caregivers are always innovating and having to problem solve differently, regardless whatever tools that may be evidence-based to sort of be a place, but they may not fit perfectly within our scenario. So figuring out how to be creative and, towards the outcome we are looking for. So anyway, without more to say, that thank you. It's been a pleasure being a part of this work and conversation, and grateful. And I have learned a lot from the coalition and those, especially with lived experience. And so, but anyway, Melissa, I will bring it back to you.
Thank you so much, Tim. Now I'm a little bit hungry. It's lunchtime here. Really appreciate your perspective there, Tim. And it's been a pleasure working with you on this coalition as well. So now I'm going to review the innovation process that we used. There are 4 key phases to innovation. The first is to define the problem. The second is to brainstorm solutions, come up with a design model idea, and then finally test the idea. We started with defining the problem. To do this, we drew from our personal experiences and learnings from the Policy Foundation sessions, which really highlighted the current state of financial stability for various types of caregivers. After aligning with the current state, our central question became, how might we ensure all caregivers are valued as essential and vital part of the healthcare system and be provided adequate support and fair compensation? Once we had our question, we began brainstorming ideas to address the question. And we had a lot of amazing ideas. As you can see, there were lots of jam boards and lots of thought processes, and really just shouting out anything we thought that would be helpful. We had a lot of amazing ideas, and it was really hard to hone in on the one idea we wanted to invest in and build out. It was important to us that we create something unique, and ultimately we landed on a communication tool. Specifically, we landed on creating a novel communication tool that complements existing resources. We call it A Day Without a Caregiver. This initiative aims to raise awareness of caregiving roles and challenges through powerful storytelling. Each episode will include calls to action at the individual, organizational, and systemic levels. We believe that this tool will be a compelling advocacy and education resource for all types of audiences, from employers to allied partners like healthcare systems. Now, we recognize that this vision is bold, and it will take time to fully develop and achieve it. Our immediate goal is to shift the conversation around caregiving to be more human-centered and to really challenge those existing perceptions. We realized that there is existing caregiver-focused content, so we did a scan to ensure that the content we created would be additive and not unnecessarily duplicative. We discussed all forms of content, including documentaries, poetry, movies, art, etc., in a really beautiful process to be comprehensive. There were aspects of all of these pieces that we really appreciated, and we also appreciated the opportunity for our content to be differentiated. We really liked content that was based on real experiences. Most of us on the coalition are attached to caregiving in a real way, so those real experiences mattered. It was important to be relatable and that it was not always negative. It could show that caregiving can be joyful or that caregivers do overcome obstacles. Some of the things we didn't like included characters lacking diversity, racial, socioeconomic status, gender, things like that. It often missed the care receiver perspective. And I really want to highlight that because that is something that we fundamentally thought was so important for our tool, to include the care receiver's experience and perspective in the work that we're doing. We wanted to focus not on the problem, but to offer solutions. And we saw that some of the content out there advanced stereotypes of caregiving and care receivers. Most of it was too long. A lot of it was very heavy. It's a very heavy subject. And there was no humor involved. So the differentiating features we identified for our content included using humor, adding that care receiver perspective, which is really important to us. We wanted to include solutions. We didn't want to just lay out a bunch of problems for others to solve. We wanted to present solutions along with these problems. We wanted to uplift intersectionality. So some of the priorities in our content are calls to action, using data, dispelling misconceptions. We wanted to show the contrast of what caregiving is like for a care receiver with a caregiver and without a caregiver. We wanted to show that there are often unexpected relationships in caregiving, and there are quality of life moments that are really touching. Now, this is all a start towards a larger and long-term plan, but our value proposition is to humanize caregivers and care receivers, present solutions to advance the conversation around financial stability, and foster a sense of belonging. Now I'm going to invite my fellow coalition member, Benicia, to share some of those misconceptions about caregiving that we talked about.
Thank you, Melissa. Some of the misconceptions that I believe we, by just joining the coalition, challenged are that caregivers don't work, that all caregivers are females. It's easy to pay for caregiving support, and caregiving is an easy task. I don't know if that's really all true. As we know, we've challenged that by joining the coalition and putting our heads together. So thank you.
Thank you so much, Benicia. I really appreciate you highlighting that. Now I'm going to pass it to my fellow coalition member, Jamie, and an amazing co-lead of our coalition to talk about the final two stages of our innovation process.
Thank you, Melissa. Hello, everyone. My name is Jamie. My current relationship with caregiving is as a family caregiver. I have 2 children, and one of them, my 13-year-old, was born with a rare genetic condition. I also have connections with other caregivers and professionals through my work with Family Voices of Minnesota. And as you heard, I was co-lead on the Caregiver Coalition. I have to shout out to my fellow co-lead, Latavia, who texted me this morning, and all of my other coalition members. It's been an honor to be a part of this process. So I'm going to move us into share more about our process from going from the ideas that you saw. You probably couldn't read all of them because there were a lot, but the ideas that we came up with as a coalition, and then trying to move this closer to reality. So once we had really differentiated the features for our content, we started to sketch out our idea. In innovation, ideas start with a model or a way of visualizing an idea, and this could be super simple, like what we did, which it could be as basic as a drawing, for example. But we began sketching out and organizing our ideas using a journey mapping tool. So we developed this framework of talking about caregiving in time increments, morning, afternoon, evening, and then late evening. And we added in that late evening to really illustrate that caregiving happens around the clock. We wanted to make sure that our stories were realistic, so we really drew on all of our own experiences and the data that we had gathered earlier in our process together. I apologize, I was checking the chat to make sure no one was telling me to slow down. We wanted to make sure that stories were realistic, and we often leaned into our community agreements that we spoke about earlier to try to take care of ourselves and to try to take care of each other, because reflecting was part of our process, and reflecting on some experiences can feel overwhelming at times. So we got to work developing storylines for this communication tool, A Day Without a Caregiver, and we began building out that model of our idea. So again, we used the journey map to storyboard or to map out what caregivers often encounter during various times of the day. We really wanted to visualize our idea as quickly as possible so that we could let other people react to it and we could start refining it. So we used tools that were readily available. We simply started building out 3 storylines in PowerPoint. And that let us highlight various caregiver experiences and try to appeal to a broad audience. During this process, most of us had to really fight the urge for this to be perfect. We had to remind ourselves where we were headed, sort of the bigger picture, and that putting things together like this is a normal part of the process. So once we had our storylines in PowerPoint, we started to share them with individuals who are representative of the audiences that we're hoping to reach with this communication tool, so that we could get feedback and make adjustments. Reaching out to research participants was also our way of making connections and being intentional about not causing any divides. We wanted to lean really heavily into the humanity and the relationship of caregiving and care receiving. With that, I want to invite fellow coalition member Emily to talk about her journey, bringing her perspective to, which is the care receiver perspective, to this work. Emily?
Hi, everyone. My name is Emily Cowell. I have a physical disability called cerebral palsy. Therefore, I am a care receiver, yes, but I identify myself as an educator and a disability advocate. When I first had the Caregiver Coalition suggested to me, I was confused, honestly. I have cerebral palsy. Obviously, I am not a caregiver, at least not in the traditional way. But as I attended more sessions, it became clear what my role was. I learned that caregivers need the care receiver perspective to be better caregivers. And I learned a lot about the caregiver's perspective, and I heard the perspectives from a variety of different types of caregivers, which I thought was really important. In creating the prototype, I thought my perspective was important because, especially since I'm one of the only care receivers on the coalition, I think no one else could draw from that actual experience. Sure, the coalition could have improvised and guessed what it was like to be a care receiver, but that is not authentic. I really enjoyed my time serving on the Caregiver Coalition. It was an unexpected way to expand my profession as a disability advocate, and I really hope I get the opportunity to do it again.
Thank you so much, Emily. It's been a pleasure to work with you and learn from you. So I imagine we're putting the slides back up, but I will continue on. For us, that testing phase was not just a formality or something we were checking off. It's really been a crucial step to either validate or challenge, or both, our core assumptions that we're making and our value proposition, which I had to look that term up because it's not part of the field that I work in, but just meaning that, you know, why is our product, why would someone want to engage with our product or service? So, but we wanted to check in, and when it comes to innovation, we're addressing 3 key areas. One is desirability. So are we creating something that people want to use? Feasibility. So what are our resources, and what are we capable of creating? And then viability. So really just making sure we're making something that's sustainable over time. At this early stage in our innovation, our focus when we were bringing in research participants was solely on that desirability piece. So looking forward, once we're confident in the desirability aspect, we'll focus more on testing for feasibility and viability. So we conducted 3 different rounds of testing with 20 people from our network. So the various coalition members pulled in people from their networks. And as you've heard, we're referring to those folks who are giving us feedback as research participants. And this slide is sharing some of the sharing the demographics of those participants. So they came from a diverse caregiving backgrounds and locations across the U.S. And we chose individuals that we have strong, trusting relationships with and who also have subject matter expertise. So as our work is ongoing, we sought feedback from those who could both support our process, but also offer constructive criticism. Laura is a fellow coalition member. Laura, I'd like to invite you to talk about what stood out to you about the research participant conversations.
Hi, and thank you. I am Laura Buckner. I am a caregiver to my 93-year-old mom. She just turned 93 last week. And my 34-year-old son, who was born with a rare disease that evolved into intellectual disabilities and some chronic and complex healthcare needs. I really liked the research participant piece of this because we reached out, we were invited to reach out to people that we knew, either in our professional or our personal networks. Either, you know, they were caregivers, they were care receivers, or they were in the industry of caregiving. So they were trusted. They were people we could trust to know what they were talking about and give us good advice. Often, those of us who recommended a certain research participant were invited to even participate in the call and listen into what was being said. It provided a degree of comfort for the research participant as well. You know, they weren't talking to a whole bunch of people they'd never met or knew anything about. The people that recommended them were part of the process. So it was important and really helpful to have somebody that had that shared experience in these sessions, and they could give us advice about what they liked and what they didn't like, what they thought worked, what didn't work. And after they gave their feedback, then the Health Leads team would synthesize their feedback and provide it all to us as the coalition. We took their feedback very seriously, and it led us to make some changes or new decisions. Thanks. It has been an honor to be a part of this process.
Thank you, Laura. Well, after each testing round, we synthesized what we learned or took our learnings from the research participants, and then we used that to refine our working model. So that approach really allowed us to continuously enhance our mock-up and pinpoint areas where we were falling short of our objectives. So as a continuation of that, as you know, this is a work in progress. We're really excited to share with you what we're creating. So we wanted to share one of our 3 storylines, and then review the storyline, and then welcome your input as we're continuing to refine this.
Domino Effect, A Day Without a Caregiver, shows Anna, a family caregiver who is caught between deciding to stay home to care for her son Javier or going to work after learning their home health aide is unavailable to come to their house to care for Javier. As the day continues to unfold, Anna is offered a promotion that becomes yet another tough choice. This is a promotion that Anna has been working towards, but it's not a given that she can accept it due to the nature of managing both the responsibilities that come with her professional role and caregiver role. This storyline highlights the challenges family caregivers often face when balancing the demands of their career while caring for a loved one. Javier, a care receiver, gets a text from his friend Miguel, who wants to visit him on his birthday. Javier can be on his own, but not for long due to certain risk factors. He values his relationship with friends, but privacy during their meetups is challenging with a caregiver's constant presence. Javier's mom, Ana, receives a call letting her know that Javier's caregiver won't be able to provide home health services today. This type of call from the agency happens often. Turnover is high, and they are having a hard time hiring new workers. Ana is caught between choosing to stay home or go to work. She's already missed many days and can't afford to miss more. As she decides, Ana considers several factors about Javier's care. He has no infections or a fever, has access to food, and seems to be in high spirits. Their neighbor, Mercedes, is usually home and willing to help out when needed, so Ana decides to go to work to fulfill her professional obligations. Meanwhile, Ana is worried at work and calling home frequently to make sure Javier is okay. Javier is home alone and doesn't eat lunch. He also doesn't take his medication. The meetup. Javier feels upset. Ana's manager, Barbara, stops by her office to let her know she's being offered a promotion. She wants to jump out of her seat and say yes, but the travel requirement stops her. In the break room, Ana's coworker won't stop gushing about his recent vacation to Europe. Ana has used almost all her pay time off for the year to stay home with Javier. Her coworker is completely unaware of her situation and assumes she's just really focused on work. When Ana gets home, Javier is not feeling well since he skipped lunch and didn't take his medications on time. He's also extremely upset about missing time with his friend. Ana consoles Javier and empathizes with him. Ana is preoccupied about the promotion and considering the possibility of accepting the offer. She recognizes the opportunity comes with added responsibilities, prompting her to carefully assess if she can accommodate the increased demands both logistically and emotionally. There are positive factors of the promotion to consider, like a higher salary and improved healthcare benefits. But most importantly, how will the promotion reshape the delicate balance between her professional goals, caregiving duties, and her own well-being? Anna decides it's best to pass on the promotion given the circumstances and Javier's care requirements. She faces reality and emails her manager to say that she will not be moving forward with the promotion. Javier is feeling upset and lonely on what should have been a fun day. Anna feels like she can't share the real reason for her turning down the role, for fear of losing her job or not being considered for future promotions. This is a promotion that she has been working towards, despite having to manage multiple responsibilities. Barbara is really disappointed and feels concerned the company will not find a better fit for the leadership role. And Javier feels guilty about having to rely on his mom so much. We ask that you consider, how can workplaces better support employees with caregiving responsibilities? As you do that, there are actions we can all take to better support caregivers in the workplace. Get informed and share knowledge about the resources available to caregivers and share with other caregivers. Create a safe and supportive space for caregivers at work. Examples include create an uplifting space, provide family caregiver days. Create and/or support legislation that invests in family caregivers and direct care workers. Examples include Paid Leave for All and Social Security Caregiver Credit Act.
Thank you so much, Beth, for doing the voiceover on that and helping us present that today. So we were going to take some time to get some reactions from all of you. And I'm wondering if I can do a time check, Help Leads team, Christian, for how long we want to spend on that and how folks can contribute. Is that in the chat?
Hello, everyone. I hope you can hear me. Jimmy, I would say about like 8 to 10 minutes that we can use for, yeah, just like discussion.
So we sort of have two asks, and the first one is, what are your initial reactions, and does this particular storyline resonate with you? And I know while this was playing, we had one person comment that it really was realistic and resonates with me and my family caregiving experience, it said. And I am seeing some coalition members talk about how cool it is to see all of this come together, as well as the Help Leads team. It is nice to see it. So how does this storyline resonate with you?
That was my comment. I don't know, did you want me to come off mute or you want me to type it in the chat?
I welcome either, and I'm not sure if that interferes with a plan I'm not aware of, but go for it, Desiree.
Yeah, no, first of all, as a working mom, we always, working mom in general is really tough. But then when you're trying to balance work life, travel, the caregiving, the home health piece hit me in the gut really strong, because here we're in Texas, home health has really, really been affected coming out of COVID. So it's like not being able to get caregivers that are stable enough to keep coming back is really tough, which also affects my daughter. She's 16, she's a teenager, she wants to go to high school. Unfortunately, she can't go if there's no nurse. So we've had days where she wasn't able to go to school. And then what does that mean? She's upset. We're having to kind of explain to her all of that. So just every aspect of this scenario really resonated with me. And I really like how you guys, followed it up with concrete suggestions for people to really take action to mitigate some of the things that us as family caregivers have to go through. So I really, really liked it.
Thank you, Desiree, and thank you for going off mute and sharing. I see in the chat, so happy to see the Social Security Caregiver Credit Act here. It's been ignored for so long, even by the legislators who sponsor it. In response to does it resonate, I see absolutely. I appreciated the breakdown of the different thoughts throughout the day. This resonates in so many ways. One in particular is using PTO for caregiving duties. I see lots of heads nodding. Another comment, so many caregivers use up their PTO for caregiving and can never take time for themselves. Many of us are running on empty. And said it's okay to voice over. Another comment, I actually lost my job due to caregiver duties and I'm struggling to find my next opportunity. It resonates well. This was always an issue when I worked in the corporate world. Incredibly realistic and so poignant to show everyone's perspective, including the care receiver. Yes, it really captures the nuance of the difficulties we face every day. I think the focus on different times of day is excellent for people who are not caregivers to help them understand the reality and actual impact on caregivers' lives. I think about this like, oh, everyone's excited to get off work so they can relax. And that's not the reality many of us come home to. I am a family caregiver of a young son with medically complex disabilities. The shortage of stable home health nursing for him has severely impacted his ability to attend school and for me to continue on my previous career trajectory. My advocacy colleagues and I have talked a lot about how to show these consequences of the caregiver workforce crisis. Well done. And another shout out to Beth, and it's nice to see our work begin to take shape. Team, I'm sorry for reading all of those. I want to make sure we capture them, but I also welcome folks to share if they're able to unmute themselves. I welcome that too.
I can jump in real quick, not to go off script too much, but it's incredible to see how we as a coalition were working this so deeply, like so in our thoughts being so in the weeds a little bit, but then to be sitting back right now to hear some of the outcome of this, to me, it was almost like I was hearing it the first time and it touched me so deeply. I don't know why, but I know I have heard of it, but like I don't know if it was because to hear my fellow coalition member narrate it, knowing the work that has gone into it, but I think it is such a deep story. And to me, it was almost like I could almost see it on a commercial on TV. Like if there was someday, somewhere, somebody who can really put this message out there on the broader media to really to help other people understand, because I think it is such a realistic story and as many people can relate to.
Thank you, Tim. So we have one more inquiry, and feel free to keep putting stuff in the chat. I may not be able to read everything as we move along, but we wanted to know, and some of this has already come up, but how might you use this content to improve caregiver financial sustainability? You know, many of us were imagining having something that was shareable or that would really help people or help us humanize, this issue. But I'm curious if other people can imagine how they might use it.
So Jamie, this is Kathy Salazar. This is an area that I work on professionally with families of trying to figure out what does, how can they stay home and not have an income, right? I have a lot of single moms that I work with, a couple of single dads, and it's been really important through the Medicaid system or Medicare system to really figure out what those resources are in each of our states. They vary. They vary by waivers. They would vary by what you have access to with SSI or SSDI. And so really trying to, find that person, whether it's through, if the family's being helped by Title V and SHIN, especially the children and youth with special health care needs, going through Family Voices, going through Family to Family Healthcare Information Center, to really kind of find out what and where, is changing within their states, because CMS is looking at paid caregivers for families if your loved one qualifies under those waivers, but the state has to ask for it. We're just starting to open the door on looking at paid caregivers for children under the age of 18. And so that is becoming a reality, although it's had many bumps along the way. So I encourage anybody who has questions about what paid caregiving looks like for a loved one who lives in your home to really just contact, who either through Title V or through Family Voices or the Family to Family Healthcare Information Center. There may be other there may be other nonprofits or other government agencies within each state that may help with these resources, but it's important to have those questions and ask them. And, I just encourage families to continue to plug away and call their senators, call their congressmen, and tell them how important having access to this form of an income to be able to stay home and take care of your child. It really tends to reduce the need for nurses and home health aides who are not readily available through the waiver systems, or even just direct service providers, which can be a home health aide or, a homemaker. So please continue to look in your states and see where these may be available. Look through, if your loved one is on Medicare. I don't know much about Medicare systems, but I know they do pay for caregivers. So what does that look like and how do you access it? So just encourage you to just don't take no, just knock on the next door and keep going, because it is there somewhere, or encourage your state to look at it.
Thank you, Kathy. I see Emily has her hand up, and then after that, I'll probably move us along. This has been a great toe dip, and I appreciate all the comments in the chat. Emily?
I think you could show this to caregiver agencies. It is not easy to get a caregiver started, and this creates awareness.
Thank you so much for participating in our process with us and letting us share our process a little bit. Before I hand it back over to Nancy, I just want to, I think we might have one more slide or two more slides just to talk about what findings we got from research participants during that during the research phase that is continuing. We heard that there is definitely a demand for storytelling, and we're hearing that from you today as well. People are hungry for for stories that humanize and prioritize authenticity. We heard that people feel like there's an overemphasis on academia and the current content that's out there, And that can often feel like it's stripped of the human experience when we're talking about caregiving. There is a preference for concise impact, so those shorter videos or content that we hope will go viral. There's not a lot of time for longer content. And participants really resonated with the storylines and felt acknowledged and understood. We also identified areas that we need to strengthen. You heard us talking about how humor integration was an important aspect for the coalition, but our attempts at humor in these first models were not always fully understood, and so participants confirmed that tasteful humor can make content more relatable and kind of temper those serious topics, but we probably have some work to do on that. And then we can always be strengthening the care receiver perspective. So that's another one of our priorities, and we've yet to just fully capture the care receiver's viewpoint. We also heard things that gave us a lot to think about. So we learned that some people don't think of themselves as caregivers even, but as life givers. Some people shared that the perspective that most topics are around adult caregiving focus on seniors, and it makes caregivers who care for their adult children feel kind of left out. So overall, research participants agreed that a day without a caregiver would be a useful tool. And if we keep working on improving the communication tool, it could become uniquely powerful. So thank you all for engaging with us and reviewing one of our storylines, and I will pass it back to Nancy to close this out.
Thank you so much, Jamie. So we as a coalition are really proud of the progress that we made. As you heard from my colleagues, there were so many steps that we had to come from to show you the storylines that we shared today, and we have 2 others that are coming up before the end of the day, so stay tuned for that. But we went from all those sticky notes to ideas, and then bringing the diversity of our own ideas, such a diverse group with diverse opinions. The process wasn't always easy, right? Change and innovation can sometimes be messy, and we did get into it with each other, which was fine because we welcomed everybody's voice. But then we embraced the uncertainty, even if sometimes we didn't know where we had come from, we had to constantly remind ourselves what our goal and our end mission was. So we embraced that, and we collaborated together and put all our diverse perspectives into this design process. So they were really focused and really family-centered and human-centered as a design process. The mock-up that you saw here today, a day without a caregiver, represents all that brainstorming, a year worth of brainstorming and building and refining. Obviously, it's still a work in progress. And so we appreciate the opportunity to share it with you all today. And please continue to give us feedback through the chat. And if you have any questions, please put those in the Q&A section so that we can get that feedback. We're gonna save everything that we learned here today and take it back and continue to refine our process. So we accomplished this work by remaining committed to building power among coalition members, to ensure inclusivity and make sure that everybody's voice was heard. That was a key component that was really important to us as caregivers, and is important for us here today, this summit. So thank you for being here, for engaging in our work, for taking the time to listen and sharing your inputs. It's always rewarding to hear from other caregivers and care receivers in this space. So this process really began by us connecting as caregivers who had similar passions. And we, like I said before, had not always had opportunities to share and collaborate in spaces before. So throughout the design teamwork, the original design teamwork, through the summit, that the Caregiver Summit that we started, the first one, and then here today, culminating kind of in what is our overall initiative to address caregiver financial sustainability. So please continue to give us your feedback through the session. You can do so by clicking the rate session button, which can be found directly underneath the session. There you go, that's what it looks like. So please continue to do that for us. We know that partnerships are of all kinds are essential for us to continue to advance this work. So at the end of the survey, if this is something that you would like to, you're interested in learning more about, or you want to support, or you want to continue this work, please let us know in the survey. Like I said, you know, I've seen so many names today. Looking at, I've seen some names of people that attended the last summit and even some members of the original design team. So we want to continue to build upon that. So this concludes our keynote session. Like I said before, please stay tuned for 2 other storylines which we have, and we definitely want your feedback on that.